If you can't turn your head to the left, is your neck the actual problem? Could it be something else down the chain? Welcome to the Cheer Athlete Podcast. If you don't know me, I'm Laura Turner, I'm a doctor of physical therapy, and I help coaches and parents navigate movement so that your cheerleaders can stay healthy and keep progressing for as long as they want. So today we're going to talk about neck motion. Most people immediately think, oh, my neck is tight. It must be, I've got to stretch it and I need to work on increasing neck mobility. But what if the neck is simply the place where you're feeling tightness or where the pain is coming out, but it's not actually the area that you need to work on? So today we're going to look a little bit differently at neck motion and not just necessarily as a need to stretch motion, because y'all know I don't think that stretching is the answer to most things, but looking at the neck as one piece of a full movement system. Have you ever been driving and you go to turn and look out, back up, and you realize, oh, I can't go any farther. And then you have to actually turn your shoulders to be able to look behind you? Our neck is not actually made to go fully behind us. That's why we have mirrors. But we have to go in opposition with our trunk. And sometimes if you turn your head to the right, like when we walk, your trunk will rotate to the left. We actually look straight forward, and automatically our shoulders do that, and our trunk, the rib cage, does that. When we're backing out of a car, we're going to turn the head. We're also going to turn the shoulders in the same way so that we can get that extra bit of motion in looking behind us. The same thing if you ever see a cheerleader tumbling and going into their handspring and they are just chucking and leading with their head, their neck motion is doing all the work. Well, that's not where that motion is supposed to come from. But you can bet that they're going to have some neck pain with that. So the question is, what is it we have to do to be able to fix this? If you continue to stretch all day long and it just comes right back 20 minutes later, maybe stretching isn't the actual answer. I always start from the head down, and we're going to look forward and back, bringing the chin down to the chest and seeing, does that actually come all the way down? Do you get a rounding in your neck as you bring your head forward? And can you actually touch your chin to your chest? We're going to look at extension. When you look up to the ceiling, a lot of times we'll see people, if you can see it in the video down lower on my neck here, a lot of people will hinge there and just kind of dump into that extension. And that tells me automatically they don't have control and they don't have a nice fluid motion from the skull down through the top of the shoulders. There are 7 vertebrae in your neck, and they all have to segmentally move, and they have to do that forward backwards. They have to do some side bend, and they have to get some rotation in. And if they don't have that motion, or if it all comes from one spot, like that lower cervical, it creates more of an issue, less stability up above, and maybe more tightness down below as well. And then look at rotation. I do a combination where we'll look over the right shoulder and bring your chin to your collarbone. So you're able to do this on both sides. The key thing is looking, is it symmetrical? Can you turn your head evenly to both sides? And does it hurt? If it hurts, you should refer out and get more information and see what is actually going on. If it's limited, quite often people can only turn 50% and they can't bring their chin down. Some of that's just learning how to let their head come down, and some of it's because they have to do some exercises to allow that to happen. We want to make sure that we're not looking for perfect numbers. You have 90 degrees of rotation because that would be relatively normal. But do you have it equal to both sides? And same with forward and back. You don't have the same motion going forward and back, but neither should be painful. And we should be able to do it smoothly without hitching. And we should be able to get a nice rounded curve through the neck as you look up. Those 7 vertebrae that attach at the neck, they attach at your thoracic spine. And then down lower, it's also affected on the rib cage. The rib cage attaches into the thoracic spine. The mid back is thoracic, and then your lumbar spine is the lower back. The ribs and the thoracic spine need to be able to move together, and they need to have enough motion to allow our necks to do what we need it to do. Like I talked about in the beginning of the episode, our neck has relative motion as we're walking. Our shoulders will rotate to the right, and our head rotates to the left so that we can keep our eye on the target and keep looking straight ahead, and vice versa. When we rotate to the left, our head will rotate right. So we have this fluid dynamic motion of segmental The neck rotates one direction, the thoracic, the mid-back rotates another, and the lumbar will rotate the opposite, and actually moves along with the rib cage, or moves in opposition from the rib cage. We can look at flexion extension of the spine. When we flex is bending forward of the thoracic spine, and when we lift it up is extension. And an anterior and posterior tilt of the rib cage. But if we're coming forward, that's an anterior tilt. And if we're lifting up, that's a posterior tilt of the rib cage. I think we've talked about this in the lumbar and the bending forward also. You can anterior tilt for just sticking your butt out, and then posterior tilt, tucking your bottom under. Now, when you put that in conjunction with the head, we didn't talk about protraction and reach. So protraction is your head is going forward and your chin's jutting out, protracting out. And retracting is like a turtle's coming back. And so we need that motion also. That happens a little bit more at the upper cervical region and your skull. So as our chin comes forward, our shoulders and our rib cage goes into an anterior tilt, and our thoracic spine goes into flexion, and our lumbar spine will go into flexion. And then as you anterior tilt your pelvis, sticking your butt out, and you posterior tilt your rib cage and extend your spine, your chin and your cervical spine will retract. And this is segmental motion, and what I call cogs by way of anatomy of motion and Gary Ward, is that segmentally moving like the cogs of a wheel. And we want that to happen both up and down, and then also side to side. And you do that same side bend. If you side bend your shoulders to the right, your head will tilt to the left, and vice versa. As I shift my shoulders down, I'm tipping my rib cage down to the left. My left cheek wants to lift up and hike my hip, and my head, to keep me upright, is going to stay tipped to the right. So we have the segmental motion in all the different planes. And the key is making sure that we have that motion evenly. So if somebody is having a hard time going into a handspring and they can't control that, it might be coming because they need to get that extension from their thoracic spine, and then they don't have that, so they're trying to get the motion and force that with their shoulders to be able to get back and see where they're going. We shouldn't be whipping around when we're doing fulls. Our head and our eyes are going to go, and the eyes and the head will absolutely lead you if you're doing either a tumbling full, or you're doing a full down from a stunt. But the head has to be able to rotate with the trunk. And so if we're whipping too hard with our neck, our trunk may lag behind because it's trying to provide stability. In this, you can look at your eyes too, and this gets a little bit in depth. When you're a baby, that's the first thing that moves. You hold up something to a baby and they're going to track it with their eyes. The same thing goes, the eyes attach, the muscles that move the eyes attach at the top of the skull. And when we turn our head, we can create a little stability at the upper part of the neck. And the next thing that happens, the baby wants to turn. If you bring the object over to the side, the baby wants to turn their head. And then they're going to start to roll. And then that's when the trunk comes in. And we go over and get onto our belly. And we have to work on neck extension and lifting the head up. And we start that by looking up with our eyes. And that extends in through the upper back and the spine also. You can see all the segmental motions from the neck and the eyes, starting with developmental positions, all creates perfect movement through the body. And when we have a compensation, it just tells us that something isn't moving right. And our job is to find out why. Your body doesn't know that we've divided into your neck, your shoulder, your back, your hip, your ankle. The body just knows it has to move, and it's going to move in whatever way that it's able to move. And so that's when sometimes it creates pain. We look and see where the compensation is, what is not moving, and then reintroduce that movement into that. Your body will be incredibly good at adapting and finding a way to accomplish a task. If you're trying to do a handspring, your body's going to get there. Maybe that's too much neck motion. Maybe it's sitting down too much and getting more into your sit to throw you back. Or when you're driving, it might be a matter of you have to turn your shoulders. So the body will find a way to accomplish a task. And then we got to find out if the strategy is actually useful for us or if it's actually a problematic. So one thing you can do, looking at a simple screen for yourself, I want you to sit comfortably, look straight ahead, pick something straight ahead of you. I've got a bulletin board straight ahead of me that I can focus on. You're going to keep your head there and then just gently turn your shoulders to the right. Come back to center. Notice what happened. Where did you stop? What did it feel like? This is key. I see this in the clinic a lot. I ask people, what does it feel like? And they most frequently don't know. They ask me, is this right? Am I doing it correctly? And I'm going to ask them, well, where are you feeling it? So a big part of knowing if something is being done correctly is, what does it feel like? When I turn my shoulders to the right, I shouldn't be getting pinching pain. I should feel this in my trunk and maybe a little stretch if things are tight into my neck. Come back to center. So we've focused on the spot. We've turned our body to the right. We notice what that feels like at the end range. Not making any judgments right now. We're just saying, oh, I got a little tweak in my neck. Maybe I have a little tightness in my rib cage. You're going to come back to center and then try it to the left. Does it feel the same? Are we equal on both sides? Can we move the same? Is one side tighter than another? Compare and don't just look at how much range of motion, which is important, especially 5 degrees difference, not that dramatic. But if I can get to here in my full range of motion, I just compensated to get there. And I can only go halfway to the other side. That's a big difference. And that's something to make note of. But looking for the smoothness of motion, does it hurt? And how much effort do we have to do? You want to see, is it easier on one side? When I rotate this way, does my head tilt to the side? Does your shoulder, am I trying to get there? Quite often in standing, I have people rotate and they're going to reach their arm across and really throw them around. The arm is supposed to go with you and it rotates with you, but it's not meant to be the primary mover. Another big key thing is, are you holding your breath? And this is something that's a relatively easy fix. So if you notice when you turn, you tend to kind of keep your breath and hold. You might try turning and exhaling and seeing, does that make it go easier? Or vice versa, do an inhale. Your oblique muscles help you as you exhale and they help you to rotate. So shortening them is a logical thought process to get yourself to turn. So as you breathe out, you activate your obliques and your transverse abdominis, and that should make it easier. But sometimes it doesn't. Sometimes you need to get the exhale. So play with what helps to make that easier and better. The other breath work that you can check in with, if you're tight and you can't actually flex your neck and you kind of more rounded shoulders and have a hard time coming down, maybe your head is more protracted and out, you might need work on your exhalation. And working on some neck flexion as you breathe out may help that motion to get better. When you tip backwards, the extension motion is more of an inhalation. So if you don't have that motion coming backwards and you're tight through your upper back, your diaphragm can't expand, your rib cage doesn't expand, and we kind of fall into the neck. Try doing an inhalation. So you'll breathe out when your head is down or center, and then inhale as you go back. And see, does that make a difference? These are things to play with. If you change your breath with either position or with any motion, and you check on the breathing in or breathing out, does it make it better or worse? And just make note of that. This isn't going to diagnose of what's going on, but it's going to give you information on how something moves. People get very tied up into diagnoses. I have a client right now who has left-sided leg pain. Started at her hip, thought it was her hip. It happened after a fall. Everything ruled out for fracture. Nothing's broken. That's all good. But really intense pain there. She went to see a different doctor and he diagnosed her with sciatica. And she's concerned, like, well, is my treatment going to be different? Well, no, because I don't care about the diagnosis. I care. Of course I care. But your diagnosis doesn't tell me that you have sciatica, you should be walking. You have stenosis, you should be sitting down. I want to see how you move. If you can't stand on one leg and you're trying to fly, I'm not looking at, oh, you can't stand there because you strained your glute med or you have hip impingement. Don't want you to have pain. So if you have pain, we need to know about that, but that's something to work on. But I'm going to look and see, how do you move? Whether it is for stunt and tumbling or for someone coming into the clinic after a fall, I want to see how you move. What can you do? Does your neck move the right amount? Does it move equally? Does your trunk move? Are you getting more motion at your neck and less motion at your back? In standing, are you able to set up centered, or are you favoring it and going out to the side? And those are all things that we can look at to see, okay, what do we need to change for movement? The diagnosis doesn't matter, but the movement and the quality of movement and what it feels like does matter. So a key takeaway that I want to take from this episode is that you shouldn't automatically assume that because your neck is tight that you need to stretch it. Sometimes you need to mobilize your upper back. Sometimes you need to strengthen your neck. Try to find out what changes the movement. Maybe it's breath. Maybe it's if I turn my head and I don't let my body rotate at the same time, it's better. Or maybe if I can turn a little bit and just a little bit of compensation, that makes it better. So try to look and see whatever the motion might be that helps to change the movement and make it feel better. It's really important for cheer athletes that they have good head and neck orientation and that they're aware of where their head and neck is on their body. So doing things that help to create awareness into neck motion and creating some stability down the spine can help them to improve their tumbling and improve their stunting and spotting. If a spot and a base have to really look up a lot, even just slightly tucking the chin might make that feel better, because if we're just looking up and shrugging your shoulders, it just jams everything up into the neck. So seeing, can they change that position? Can they let their shoulders relax? Can they focus on breathing and try to exhale so that they can hold and be more stable and not just use your neck to do that? So I asked in the beginning, if you have trouble turning your head to the left or to the right, is your neck actually the problem? It might be, but let's not just assume that it's a neck problem. Let's assume we need to find out where the motion is and connect the dots. Look at how the neck moves, how the trunk moves. When you bend forward to touch your toes, are you keeping your head up or are you looking between your knees? Because if you're keeping your head up, you're seeking stability in your neck and you're not getting that stability through your core. So stretching the neck won't do you any good. Activating your core might. You might need to stretch the neck and then activate your core. But right now, think about, okay, can I do this motion independently? Can I do these combined? As I bend forward to touch my toes, does my neck flex, and can I look between my knees? As I lean backwards, do I lead with my neck or do I lead with my hips and my upper back? And does my head go along for the ride? Looking to see how your athletes are moving will really help to give you better exercises to give them to help them, and recognizing that just fix it and change how you're holding isn't always the answer either. And just doing more stretches isn't the answer. I posted on social media, if you don't have a way to assess and you're not looking at if an exercise is changing the missing piece, are you actually doing your athletes a benefit? You need to have a system in place to be able to assess how they're moving so that you know what exercises can improve that movement and what exercises they need to do to get beyond that movement and get even better. So I encourage you to start to look at movement. The sitting, rotation, you can do it in different positions. It's a great way to get the feel for yourself and your own body. And then check in and see all the cues that we talked about with the breath and all that. Does it actually make a difference? Start to feel it for yourself. Start to observe people through the day. Watch all your athletes move and compare and see, is there a difference between Susie and Laura? Because likely you'll see a difference. Doesn't make it wrong, but if they're having compensations and they're not able to do something that you're asking them to do, that might be a cue that you have to kind of dive a little deeper and give an individualized exercise. I think it's really important with that movement tracker. That's not meant to be the end all be all. It's an assessment tool. And then your warm-ups are your exercises to correct that motion. I don't know, but we create movement that helps to make that motion better. We do that and we go back and recheck and we'll see we made a positive change. Awesome. Now here's your warm-up when you come into practice or before you go into the gym to lift. You're going to do these exercises as your warm-up, and then you can get on and do the activity. You're setting your body up for a better position, no matter what area is limited. So I encourage you If you don't have one already, you can download my free movement tracker. And if you're interested in learning more and diving deeper into creating a better system to assess movement for your athletes and for the kids that you're coaching, and you want also to get some exercises that go with that so that you can test, correct, and retest, then stay tuned because I'm going to create a program that will do that. If there's interest, please message me on Instagram at the Cheer PT and let me know that you're interested because I will keep you in the loop when that all comes together. So next week, we're going to start moving from the neck and maybe look a little bit more at shoulder mobility and how is it actually your shoulder that's the problem, or maybe is it the neck, or maybe is it the upper back. So if somebody can't do a handspring and they can't raise their arms up this way, it might not be their shoulders that they need to stretch more. So stay tuned, listen in for next week, and make this week a good one. I hope you have a great week. Don't forget, when in doubt, breathe out. Take life one step at a time. You can do anything you put your mind to. And as my friend Drew Kelleher said, you're responsible for your own vibes. So go get the day.